Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Hey.
Good morning.
Good morning.
Доброе утро.
Доброе утро.
Okay, so we're here. Where are you
Ina is talking.
listening?
Ina is talking.
Yeah, right. She's talking. She's talking. So this is a good morning, and we've had a very good show so far. And now we have Dr. Andy Mencia here, who's going to do some talking about something that I've been very curious about, and that's skin cancer or the prevention of or what we're supposed to do.
And the myth out
myths.
there. You know, people think, I was just watching the news this morning. And when you look at the weather to see how much rain and what time we should be expecting the rain, I saw the UV index to be moderate. It's not high because it's not sunny, but people will go outside and say, I don't need sunblocker. It's cloudy.
Right.
But in reality, even a day like today that is cloudy, the UV ray can penetrate through the cloud, and people don't see that. So that's one of the major myths we have to take out of the way.
But let me ask you, because you're like we have a little darker skin. I mean, our
Right,
skin isn't
olive.
the white skin.
We have that
So,
olive skin.
We have olive skin. Are we we're less
I
prone?
love olives.
Aren't we? I'm going to ask you, can your lips get cancerous? Anyway.
Can the lips get cancer? Yes.
Okay, wait, before you
Yes.
answer that, I just want to ask you a question. Are we less prone because of our skin color to get skin cancer?
We are less prone because we have more the
Melatonin.
melatonin to protect the skin. The lighter the skin, like Ina, she's very light, fairly
I don't
light,
like that
but
much
she's
olives.
No, that's right. She's very white skin.
She's very, very white skin, blue eyes especially. So a person blue eye, light skin is much more prone to cancer than a dark person with brown eyes.
Okay, so when your patients come in, is this part of your examination to look them over? You're not a dermatologist.
Right.
Does it matter?
Well, it doesn't matter, really. As a matter of fact, you should feel comfortable with your primary care doctor that if you see anything that don't look right, ask your primary care doctor. And, you just hope and pray that if he or she know what they're doing, they can give you a solid advice whether to worry or not. And I feel so comfortable that many, many times if I see something that is completely benign, I tell my patient, don't even worry about it. Where you get other doctors that will say, if you ask me, I'm going to have to send you to a dermatologist because they are scared that you're going to sue them if they are wrong. So it's how confident your primary care doctor is with skin disease. And the prevention of skin cancer starts with self-inspection. You know your body. And you are the only one, or you and your close one, are the only one that get to see yourself, butt naked. And you should take from time to time that opportunity of being butt naked and check the sole of your feet.
The soles of your feet.
With a mirror, you take a mirror. If you cannot take your foot and bring it all the way up so you can examine it, at least, bend your leg and take a mirror and look for any dark spot. A lot of people get melanoma, which is one of the deadliest skin cancer, and they get it right on the sole of their feet, and they don't even know they have it. Behind the knee, you can, people don't look behind their knee. It's very hard to look behind their knee, but if you have a mirror, and I always have a mirror in my bathroom. I usually have a portable mirror in my bathroom. And you can check behind your thigh.
What's it going to look like?
That's a good question. So what we call the ABC of cancer, right? The ABCD of cancer. Okay? A is for asymmetry. So when something is symmetrical, if you have a dime and you cut it in half, one side of the dime is going to be symmetrical to the other side of the dime. But if it's asymmetrical, if you cut that lesion in half, you just draw a line with your, use your imagination and draw a line right in between the lesion. And if one side look much, much different than the other side, is asymmetrical. So let's say a pimple. When we get one of those pimples on the face or on the back, usually they are very symmetrical. So if you draw a line, you look at a pimple in the mirror of your face, it usually will look very symmetrical. A skin cancer on the face will not look like a pimple. It will look asymmetrical. One side looked completely different from the other side. That's the A. The B is for borders. Now, if you look at a pimple again, that we know is very benign, the borders of the pimple are very smooth. You can easily distinguish the pimple from normal skin. So let's say if we're going to bust a pimple with a needle, we know where to hit it, and we won't hit normal skin because there's a demarcation that is very clear and smooth. If it's skin cancer, it has little legs sticking out because cancer are aggressive. So when you look at the border, they look very rough. You see that it goes like a little star sticking out into the normal skin. So it's sort of harder to distinguish between the lesion that we are in questioning and normal skin. So that's the border. The A is asymmetry for pencil talk listener, and the B is for the border. If the border is smooth, most likely you don't worry about it. If the border looks rough and is sticking out like a little indentation coming out or little feet sticking out, then you worry about it, okay, regardless of the size. The C is for color. So the C is for color. And in color, if the color like a pimple usually will be kind of pinky, right, or red, but a lesion might be, let's say, black on one side and brown on the other one. Or pinky on one side and black on the other side. When you see multiple color, it's not homogeneous, you should be concerned that it is skin cancer. And I have to give you a trick. I have to give you the D, but let me give you a trick.
Okay, trick.
One of the tricks that I use is all of us now have a cell phone. Everybody's cell phone has a camera. Except those people that still have cell phone from the 80s. Most cell phones nowadays have a camera. You turn on your cell phone, and you can put the phone so that the camera is facing your face, and then you can look wherever your lesion is. If it's behind your knee, on your thigh, on your butt, take a picture, and then take that picture and magnify it, open it up.
Great idea.
And that's like taking a magnifying glass. A lot of times when my patient come in, I go with my phone, and I go in their back or their butt or their leg, and I take a picture, then I discuss it with my patient. And I go through the ABCD of
Wait, you didn't give us a D. There's a D?
D is coming.
It's a D.
But I just want to stop there with the phone, because, we all have a phone. Take a picture, you can send it to other person, you can send the picture via text to anybody. So take a picture and send it to your doctor's office, send it to whoever you feel comfortable with if you have concern. When you come to the doctor, if it's an area that you don't feel comfortable showing, take a picture and show it to the doctor so that you can magnify it.
So it's not necessarily a rough piece? It could also just be flat and just...
It can be flat, but with multiple color. Now, you have to take all of them, the A, B, C, D, all of them into consideration, because you might have a little asymmetry, but it's homogeneous, same color, smooth. The borders are smooth. If he has the more than 2 or 3, the more he has of those categories we are going through, the most likely is cancer. The less he have, if he only have one of the 4, then possibly no, but ask your doctor. Don't leave it there because you only have one. Let's say if you only have the color change, for example, melanoma is no, it might be just black. So you say, oh, it doesn't have different color, it's just one color. If it's black, you worry, you're concerned. Especially if you have dark skin. So, dark skin, melanoma will tend to blend very easily with the rest of the skin, and you might miss it. But if you see that black pimple that have pop up on you and it's growing, and it's meeting all of the criteria, because melanoma is very classical like cancer. The border will not be smooth. It will branch into the border, and it will do everything that we are saying here, the melanoma, very fast. So one of the things that you want to do as you go through the ABCD on any lesion that you have on your skin is monitor that closely until you see your doctor. And if you see that it's changing fast, then you have to get it taken care of immediately.
Okay, well, we're going to talk about what that means, but give me D.
The D is diameter, the diameter. So we say about 10 millimeter or wider is definitely to be concerned, regardless of the ABC up to this point. So the D is for diameter, and how do we know 10 millimeter? Very easily. If you look at the eraser on a pencil, it's about 10 millimeter. So if you take the eraser of a pencil and you put it on top of that lesion and it stick out of the pencil, of the eraser, most likely is need to be looked because it might be a malignancy.
Okay, so now you have a patient that has some of these and you are concerned. What do you do then with them?
That's a good question. Well, here come the business part and the human part of being a doctor. The business part, most dermatologists out there, what they would do, they take a biopsy first.
What does that look like?
Biopsy, that when you go and you cut the lesion, you take a little portion of the lesion and send it to the lab to be analyzed. And then the lab will come back and say, oh, it's a squamous cell cancer. Then we'll bring you back and say, okay, we have to remove this squamous cell cancer. My personal approach is that if you have something there that is small enough, instead of taking a biopsy, I like to remove the whole thing. I usually tell the dermatologists that work there, or myself, if I'm the one doing the surgery, I remove the entire lesion instead of taking a biopsy.
Is it deep?
If you have to go deep, you go deep. But you remove the whole thing. You can send it to the lab, but at least you can give the patient peace of mind that if it was a basal cell or a squamous cell or melanoma, that at least we have taken the whole lesion out, and then we can follow. So when removing a lesion, we have to think in 3D, 3-dimension, because like you said, the diameter only tells us about the width of the lesion, not the depth. So when we are cutting, we usually palpate the lesion, and if it's like a pimple that bounces right back at you, it's deep into the skin. If it's sort of flat, it will just go with the skin. You just move down with the skin. So when we make like what we call a Chinese eye incision, which is like an incision that we go around the lesion, taking normal skin with us. And then we go deep into the skin, and then we put a suture or two to close, and then we take that portion that we took out with the lesion included. And the reason you want to do that is because you don't want to leave anything behind. So if when you cut all around normal skin and deep enough to remove everything, and then when it goes to the lab, one of the diagnoses that we are looking is what kind of malignancy it was, what kind of lesion, was it benign or was it malignant? And if it was malignant, what type it was. But most importantly, I want the pathologist to tell me that all the borders are benign skin that I have sent in. That means the entire lesion have been removed from the patient. Now, that's from the local point of view. Now, remember that melanoma, skin cancer like melanoma can kill you.
I know. I was going to ask you that because I know people who have died from melanoma, and I don't understand that. What is
Because
that?
what happened is a person, first of all, they don't do what we are saying here today. They don't self-examine. They don't examine their body. They don't look at the bottom of their feet. They don't look for lesion. And, once in a blue moon like today, if you have nothing to do, go and get butt naked and check your body. Go through it between your toes and check yourself. If you find anything, then monitor that. We don't do that. We just say, this little lesion here, and then you go back 3 years later, and it's, what was in your little toes is now down to your heel. Most likely you let it go too far. If you have a lesion behind your knee, and you let it, behind the knee is a fossa, what we call a fossa. It's an empty spot in there. So if something grows, there's so much room to go inside there without you feeling it, that by the time you realize it can hit your bones. And if it hit your bone, that means amputation.
Yeah, thank you, because I was just telling Dr. Mencia before we started the show that I found someone, I don't know the person, but a friend told me that they had a cyst behind their knee, and then they went to the doctor, and it turned out to be cancer.
Cancer.
And they wound up having to amputate this whole leg.
Yeah, once you have,
hard to
once it hit
believe
the bone, then in order to salvage the person, you have to amputate the extremity, and you have to go. Now, when amputating, you know what we have to do? We have to cut the leg. Then we take a piece of the bone that is left on the stump of what remained of what was your leg, and the pathologist is right next to us during the surgery. So we give that to the pathologist. The pathologist looks, it doesn't look good. It's still infected, or it doesn't look normal. Then we have to cut higher. And then we take another piece of bone of what's left behind, and we give it to the pathologist and say, okay, this look okay. This look like normal bone to me now. Then we stop there.
But this person now said you have to go to an oncologist and have
then,
chemotherapy.
Of course, because why melanoma do kill you? Because melanoma, once it develops, then it's on the skin. But the skin, remember, it is the largest organ in our body. You have the liver that is huge. You have your lungs that are big. Some people have a big brain. No.
Yes, you do.
That was a joke.
Yes, you do.
But the largest
do.
organ is the skin. The largest organ in our body is a living organ, the skin. And the skin, of course, need energy and need nutrients and need to be taken care of like any other organ. So therefore, it have waste production that need to be taken care of. So the waste go through the lymphatic system and through the vein. So the melanoma, once it hit, then it start going through the lymphatic system. So by the time you realize it's on your groin, or it's by your spleen, or by your liver, so it's spread very, very fast, very easily. That's why it's very important that we don't underplay skin cancer.
Well, with your saying that, I want to tell everybody, if you have never heard this show before, you're listening to the genius, the genius of the wonderful world of wellness, Dr. Andy Mencia. Your reputation is so stellar. I mean, I talk to people about you, and oh yeah, they heard of Dr. Mencia and all. But I have to just say, it's such a pleasure. But if you really would like to have an excellent, actually an extraordinary doctor, you should call them. They are open on Saturdays. Just write this number down. It is Pencil Talk Radio. And if you have that pencil and a piece of paper, it's 954-489-1345. And I'll repeat that again, 954-489-1345. And that's their office or their center on Commercial Boulevard. It's a very large center. They have so many professionals all there ready to help you. And then they have a new office in Boynton Beach.
It's not new anymore.
Yeah, it's a year old.
It's over
Sorry.
a year already.
Sorry.
And they'll open on Saturday too. Now they are competing with us.
Fantastic. It's over on Hagen Ranch Road in Boynton Beach. Their number is 561 270 6494, 270 6494. And write down this website because that will help you with a lot of information. It's called AGI for Adult Geriatric Institute. So it's agifl.com. Something else very special about Dr. Mencia's idea of helping people who cannot get to his office is they have home visit services available for homebound patients, which I just admire him so much for doing this. So you have also a new person that we've added, a rheumatologist who is just marvelous, Dr. Garcia.
She's marvelous.
She's fantastic. But, we've never really gone down. And I wanted to finish, though, with the skin cancer. So I guess you have given us a lot of information, and I really appreciate that.
Sure.
And I think that people better think about that a lot.
So, remember that wherever in your body you have skin, you can develop skin cancer. So you were asking about the lips.
Yeah, I was.
Especially on people that chew tobacco. They are
tobacco, right.
They are very prone to...
Or smoke.
Smoker, more lung cancer than lips, but lips cancer, very, very common. Very common on people that like to chew tobacco. We just had a patient, I just saw him yesterday for his follow-up because he was doing great, but he went to the mall, like a lot of people are doing today, and they have these people that give massage on the side. So he put his head down in one of those chairs, and they start giving a massage. When he got up, where his earlobe was before, he was bleeding like a pig.
You're kidding?
So, yeah. So he already had skin cancer removed. He went for this massage, and they reopened the wound that was almost completely closed.
Oh, my God.
So, check your face when you go for this type of massage, where you put your head and all of that. But let me tell you about this guy. This guy came in, and he said, I feel something in my ear. And I said, what does he hurt? He said, oozing. He goes, it's oozing a little bit, but I feel like heaviness in there. So I took my otoscope, which is the little equipment that we use to go in and check the tympanic membrane and check inside the ear canal. And I see a little lump at, I think it was around 7, 8 o'clock when we look inside. I see a little lump there about 7, 8 o'clock. And it was, then I go through the ABCD, and it was meeting all the criteria. Inside the earlobe now. And I said, have you ever seen an ear, nose, and throat? He said, years ago I did. And I said, okay. And did they ever tell you about having any cyst or anything in your ear canal? He goes, no, they never said anything. Okay, give me the name. I want to get the note from that doctor. I got the note. There was nothing there. So it didn't look good. So just like most of my patients, when I see something, I have to put on the right team together. So I'm looking at this guy, retired, basketball coach, very nice guy, beautiful wife, nice people. And I told him, Marvin, I have to send you to Miami. I don't want nobody around here to touch you. We're going to send you to Miami because we have to investigate, number one, how deep whatever you have there is, and what can we do to save your life. So, of course, they get scared. I said, and I said, I mean it, because if it's something that is had penetrated into your brain, most likely we are going to do nothing. But if the brain is had not been touched, and this is something localized, and it's what I think it might be. So the wife said, "Why don't you just put a needle in there and we'll find out?" I say,
Oh, boy.
heck no.
Oh,
We're
boy.
not doing that, because if I do that, I'm gonna spread whatever is there. If it's benign, I'm spreading nothing. But if it's a cancer, then I'm spreading. And if it's aggressive, like what I'm seeing here, then we don't want to spread. We don't want to wake up this monster. When we touch this monster, it's because we're going to corner it and rip it off. So we put the team together. We put the oncologist, the surgeon, the ear, nose, and throat that specializes only in ear surgery more than anything else. And we put the whole team together at the University of Miami. The guy went there. So when he come back, he has now no earlobe. This is all removed. And when you look at this side of his face, basically you just see the skull, the form of the skull, and this whole side is empty.
But you saved his life,
But
didn't
we
you?
saved his life.
And we have run out of time. I wanted you to finish the story, but that is
Ina,
quite a story.
Go and tell Richard and kidnap him.
We
So he won't
Carp
take us
is
out.
waiting for
Oh,
us.
Joe Carp, my friend. No,
Yeah,
I gave Joe
no.
Carp.
But Dr. Mencia, that was an excellent, very, very, very powerful story. So what we said before is very important. Please be sure, set up an appointment with Dr. Mencia, 954-489-1345.
And then when they listen to Joe Carp, they have to remember that this thing, you don't program yourself. Okay, January 23, 2016, I'm going to have skin cancer. So I'm going to now go and listen to Joe Carp.
Right.
Listen to him now so that you set up your future when the time is right.
That's right. Thank you, Dr. Mencia.
Thank you, Anita.
All right, we'll be back
Thank you,
right
Ina.
away.
You're welcome.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.